This is Evie.
This is Alissa.
This is Chelsea. And this is Caroline.
Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
So today you're here with me, Evie, and Alissa, and we're going to get started talking about prospective nursing students and some advice for them. But before we do, let's just ask Alissa, how are things going with you?
Oh man, things are so busy. I think I just like to be crazy busy all the time. I'm working on my PhD. I am tutoring on the side. I've started doing some freelance writing, of course, doing the podcast.
Yeah, it's hard to let go. Hard to let go. Yeah,
definitely. What about you, Evie? What have you been up to?
I was at a conference in Ocean City for all last week, and things at work are busy. I'm doing some things in the community here. And I'm not complaining. It's just things are busy. Sometimes you want 4 hands or 6 hands, but then sometimes you're glad you only have 2. So
exactly.
So let's get started. Our topic today is we're talking about prospective nursing students and what nursing advice we would give to them, particularly from a Med-Surg perspective. And Alissa, I know you have a lot of experience in this area, not only as a Med-Surg nurse, but with your teaching and your education to nurses. Let's talk about that a little bit.
I think when you're in the nursing student phase, it's really easy to just come in with those stars in your eyes. And so making sure that you actually know what you're signing up for is a big deal. I remember going into nursing school, just having total ideation of this is going to be amazing and I'm going to save lives, and not really understanding what it meant to be a nurse. The pressure and the heavy weight of making decisions on behalf of somebody who's vulnerable and maybe doesn't have the information or the knowledge to make those decisions for themselves. In addition to, I don't know, some of those really crummy tasks that nurses do. It's not on the pamphlet, like cleaning up vomit and stuff. They don't really put that on the nursing school pamphlet. I think one of the really important things a nursing student or prospective nursing student should really contemplate is, am I doing this because all aspects of the profession is something that I can see myself doing and tolerating and being okay with for the rest of my life, not just because it sounds like fun or, all heroes wear capes and the glory part of being a nurse and feeling really rewarded by being able to be that patient advocate. There's an ugly side to what nursing has to do and has to face, and have to make sure that you're really prepared to do that.
Some good advice and some things to think about. I remember, like you, when I was a new nurse, when I finally got to the floor on my own, and I'm thinking, wow, do I really want to do this? What did I sign up for? So I don't know if I were talking to a prospective nursing student, if I would ask him or her to think about if this is what he or she wants to do for the rest of their lives. But what I would suggest or urge the prospective student to think about is see yourself from here to now, maybe 3-5 years, so in increments or intervals, to give yourself some room to grow. And one of the things I think is important for growing is asking questions, not being afraid to ask questions, and knowing where and to whom to ask those questions, whether it's about your clinical experience or education, whether it's about your interpersonal skills. I think prospective nurses need to have a realistic view of what nursing really is and how they can fit into the profession for the long term. And I think it's incumbent upon us nurses who have had some experience and time to give them that reality, not negative always. And I think it's on us to give them the truth, to give them the reality. Again, each person's experience, individual experience, will be different to some degree or another. But I think we as experienced nurses, we have the best information, real time, real information, real experience to offer the prospective nursing student.
Oh, I totally agree with you, Evie. If you ask somebody about nursing, you either get everything they absolutely love about being a nurse or all of the really horrible things there are about being a nurse. And we really need to work hard about the balance. We need to be able to talk about how there are very rewarding parts about being a nurse. It is awesome and amazing to see the impact that you have on somebody when they're in your care. that is incredibly rewarding. But also you should ask yourself, is that something that you're going to find rewarding? Is that impact on somebody rewarding to you personally? The other thing is we need to be able to share the harder side of it without the dramatization. Sure, it's fun to tell those stories with dramatization and add a little comedy for flair because we all have a twisted sense of humor. But when you're actually trying to mentor and coach somebody who's looking at the profession, you need to give them a realistic view of what it's really like. Yeah, you're going to have a hard day and yeah, you're going to have a great day. And some days you go home and you have no idea what you did, but you know that everybody was alive at the end. And so you feel successful. And there are other days that you're going to come home feeling on top of the world. And so that balanced perspective and really investigating, why are you going into this? That's something as I've gotten further and further into my career, I've had to investigate my own personal why. I remember my first day of nursing school when they have you go around and introduce yourself and why are you here? And my mom said, hey, you should go to nursing school. And I was like, yeah, that sounds like fun. Okay. But now that I'm on this end of it, it's over a decade later. And I'm like, why am I doing this? For me, I recognize that I love the impact. That's what I'm looking for. It's that impact on the patients. And as I've moved into education, it's now the impact that I have on other nurses who are now impacting patients and that bigger circle of impact. And so recognizing, what is your why? Why do you want to go into nursing? It will define for you whether or not you're going into it for the right reasons.
That's a good point. I remember, again, as a new nurse, trying to figure out what is my why, especially in those moments when you are doubting that this is what you want to do or this is what you should have done, right? So figuring out your why, one of the suggestions I would have, and it was given to me, is to help you with that why, knowing your purpose. That's your ultimate reason. It's going to be your mainstay through the tough times. Through the good times, it's okay. You kind of don't think about your why, but you really need your why in those tough times. And that's going to be your impetus, your fuel, if you will, to keep you going. That's number one. Number two is I would suggest a mentor. Now, when I first started, when I was a new nurse, I didn't have a mentor. I looked at my instructors from nursing school as a mentor, but that they were a sort of a mentor for that time being, for that educational time frame. But as a professional, as a new nurse, I needed a mentor that I can call directly, speak with directly. We can go out and have lunch, and I can just kind of, I would say, dump on him or her. But not just that, get the feedback from that mentor of where I want to go, how to get there, who do I need to connect with? And again, honing in my clinical skills. Not only a mentor, but literature even shows that more than one mentor, maybe even three, depending on your specialty, depending on your goals, 3 different mentors can be helpful for you as a professional nurse. And I think a lot of new nurses, we go in, I'm going to say we go in with these giddy eyes, and we want to save the world. And we want to, we want to save all our patients. And one of the, I guess, best lessons I learned, and this is through a mistake, not a fatal mistake, thankfully, but it was through a mistake. But one of the best lessons I learned is that, guess what? I can't save everybody. I don't have that power. What I do have is the power and the strength and the skills, if you will, to better myself, better my skills, my thinking, to give the best experience I can to my patients when I have patients in my care.
You've hit the nail right on the head, especially having the mentors. I think those mentors are so important. When I think back to when I was in nursing school and a brand new nurse, I was lucky enough to go through an internship program on my unit. So I had the ability to develop those relationships with the mentors, which was so beneficial. I had somebody to go and talk to, and I had someone to go and either normalize a situation for me or help me problem solve a situation that wasn't normal. And I am so grateful to have had those experiences. And those nurses I still highly respect, definitely will always appreciate what they did for me at that time. And as time has gone on, the role between us has a little bit shifted because they mentored me to the point where they could, and then I continued on. And so now I mentor them in other areas where I have become more proficient in professional leadership and development and stuff like that. So I will always respect them and have that high regard for their bedside clinical med-surg nursing skill. And now they're coming over and looking at me for my additional education. And so it's become, a two-way street in that mentorship. And so those relationships are so important. And if you can establish them, even if not as you are precepting into a new job, I would recommend getting to know people in your nursing programs that are maybe a semester ahead of you. They can become mentors. They can share what they're learning. They can kind of be a guide. When I was working, there was an employee on my unit who was a semester ahead of me, and she became a wealth of knowledge of just letting me know what was coming ahead and which instructors were better instructors and try and get in this person's class. And, beware, this clinical is really challenging and this might help you better. And really guiding that experience for me to help me have a better outcome. So befriending somebody ahead of you in the nursing program can even be a good start in a mentorship relationship. And it's another person that understands where you're at and you can be vulnerable together.
That's important. That's good. That's good. So, Alissa, we know that nursing is not all serious and it's not all dire. I do have some fun tips, if you will. So one of the tips I remember my instructor told us was to invest in a good pair of shoes. And she was so right, because, and that has that has stayed with me because since I've become a nurse, at least once a year, I get a new pair of shoes. And it's funny because when I'm exchanging the shoes or, going to the new pair, I look at the old pair and I'm thinking, oh my gosh, I really did wear these down. But that was one piece of advice that definitely has stuck with me, and it has proven to be so apt and so necessary. So that still sticks with me. What about you? Have you gotten any fun advice or just some lighthearted advice?
Well, on that same note, it's always making sure you have a really good pair of scrubs. I don't know why the rest of the world makes scrubs look like so comfortable and so amazing. I don't love scrubs. So making sure you have scrubs that fit well, but are not too tight or too loose. Loose fitting scrubs get caught on doorknobs and furniture and equipment. Your pockets are getting caught and torn on things. And then tight scrubs are restrictive if you have to do code management and stuff like that. So always making sure that you are feeling well in your clothing so you can move freely, but not get snagged on everything. That was some really great advice that I had gotten right in the beginning. And I'll tell you, it only takes one time to get caught on a doorknob before you're like, okay, I'm not going to go baggy scrubs ever again,
Right. Wow. So that makes me think also as well, we talk about the harder parts of nursing or the more serious parts. And then we have some levity here. But all in all, nursing has been a good choice for me as a profession. And I can think of one of the best days as a nurse that I have had was, again, not without some challenges, but even in those challenges, one of the best days I had was when I left the floor and I had this sense of, wow, I accomplished the priorities that I needed to accomplish with my patients, with my tasks, and I connected with my patients, with the 4 or 5 or 6 patients sometimes that I've had. I was able to at least establish a rapport with them where they didn't feel like they were being, left out of the loop. And so it was just a day where things just kind of fell in place. And I can't necessarily give an ABC list, but I can just tell you when I left I didn't feel like things were left undone. I didn't have a sense of, oh my gosh, I'm going to pass all of this stuff to the next shift and the next nurse is going to be busy and even more busy. But it was just a thing where everything fell into place between the patients, the communication, me completing the tasks with the patients, building that rapport. Not that some things were not on time, like their meals, but even in the task that had to be delayed, we were able to communicate and come to a resolve, if you will, for that moment where things just did not come all out of place.
Yeah, everything doesn't have to be on time, but you're in sync with your patient. You're communicating clearly with them. And so if something, meal shows up 15 minutes later, they have that level of understanding because you've been very clear and communicative with them all day. I can completely relate to that. Some of my best days as a Med-Surg nurse, I can't even tell you what happened because it's the feeling. You walk away with that feeling of success. And you're like, I don't even know how that happened.
Mm-hmm.
But it's like all the patients were cared for and we were fully staffed and everyone was in a great mood and nothing traumatic happened. And we all got through our day and had a good time doing it. Some of those are the best. When you compare that to like the worst days in your Med-Surg career, it's usually you were short staffed and you had a patient stroke on you. One of my hardest days being the charge nurse, being short staffed and my patient stroked right at shift change. Like, oh man, that was really rough. But I think anytime that I have a patient decline that ends up in a really sad situation, right? Transferring to a higher level of care. Those are usually the worst days. And it's not like I could have done anything different. It's not like I caused my patients to decline. You just feel like, I wish there was something more, right? It's a sign of defeat. Sometimes if you're like, well, I did my best and tag you're it to the ICU. Those are usually the harder days in Med-Surg, especially if you're very busy and there is someone waiting in line to take that bed right after it emptied. It's like you don't even have a moment to like process and decompress from what just happened because there's already somebody new waiting for your attention. So the good days, it's hard to identify what went right. All you know is, like you said, everything fell into place and everything was amazing and you leave successful. And then the bad days, you literally could, list it off that this patient declined and that one transferred off and this patient's family member yelled at me and whatever, because unfortunately, the details of a bad day usually stick with you a little bit better. Yeah.
Yeah, they do. They do. So I don't want to leave our listeners on this worst day and scare them. But even in the worst days, like you were saying, Alissa, sometimes you don't get a time to process it. So again, what I would encourage new nurses to do is actually take that time to process it. You may not be able to get it right at that minute, but you will need some time to process it. Probably away from the unit when you're off work. Do something healthy, maybe go for a walk, listen to music, talk with a friend, or just sit and relax and just process that. You definitely need to do that.
Yeah.
So as a new nurse, you will need it. You will need trust
Absolutely.
us. Just trust us. You will need that.
And look for the learning opportunity.
Yeah.
That's one thing that I always recommend. Anytime that you are in a situation where you did not feel successful, look for the opportunity on, all right, well, next time I'm confronted, what can I do different? How can I learn from this? Because if you go through and debrief an entire situation and the answer is no, I literally did everything I could, you really need to cut yourself some slack and let yourself off the hook then. If you did everything you could and you followed every single step properly, it's out of your hands at that point, And if there was something you could have done differently, if it was, this set of vital signs, I could have recognized the sign of decline sooner or whatever, you're going to learn from it and you're going to become a better, stronger clinician ultimately. And nursing is one of those fields that over time we become better because we learn from these situations. And so take the learning opportunities when they present themselves.
Exactly. Taking those learning opportunities again and processing, like you said, Alissa, learning from the mistakes, asking yourself, did I do everything to the best of my ability with what I had, with the situation? And using that again to grow from it. At that point, it is out of your hands, but you can use that as a springboard to continue improving, to continue learning, to continue honing your clinical skills. And I think as time goes on, the new Med-Surg nurse, you'll see the differences among the specialties. And I think Med-Surg nursing offers that perspective in the sense that we have patients that we typically don't expect to decline. We typically don't. Our patients, they may have some chronic illnesses and multiple illnesses, but we typically have the expectation, even if it's a subconscious expectation, that our patients are going to walk out the door. And that's the difference between Med-Surg and some other more critical specialties. But even when our patients do present us with this worst day scenario, we can still learn from it. We can still grow from it. We can know that we did what we needed to do and all that we could have done, and still process it through, walk away, and still, I think, ultimately come with the conclusion that this is the profession for us.
Absolutely. And, one thing I would add to that with Med-Surg specialty being so different, it is different because it is so vast. You have such a vast knowledge base when you are a Med-Surg nurse. So cut yourself some slack. It is going to take time to be proficient in all aspects of Med-Surg nursing. So it does take some time to learn all the nuances of all of the different disease processes, because you could see anything in a Med-Surg floor. It literally is medical or surgical. So you need to give yourself permission to take the time to learn what your patient population is going to look like in your place of practice, and allow yourself the time to develop those skills and become the expert in those patient populations. When you are in a confirmed specialty, when you work in labor and delivery, that's all you do. You labor and deliver babies all day long. Once you got that down, you got that down. When you're in Med-Surg, you may see pneumonia all winter long, and then winter's over. And guess what? You're going to see something else. You have to learn something else. You got to get proficient in something else. Now you may be seeing car accidents all summer. So you know what I mean? You really have to allow yourself the time to become proficient in whatever is presenting itself. So be patient with yourself, allow yourself to learn, and just know the variety of Med-Surg nursing is really what helps you keep engaged and stay so fascinated with our patient population, because it really is everyone.
Yes. This is the variety that Med-Surg offers. And I think it's the variety, it's the challenge, but it's also the reward, because we get to see patients in a multitude of aspects and for reasons. And yet Med-Surg nursing can be and is, for many of us, of course, for Med-Surg nurses, it is the best specialty that there is.
Absolutely. Like Med-Surg nursing is the best specialty because you get to do it all. And you do see your patients come in at their worst and you get to discharge them home. You get to send them back to their reality. Evie, this has been such an awesome conversation for our nursing students. I really hope that they're able to gain from this.
And with that, we will see you on the next episode of Med-Surg Moments, the AMSN podcast.